If you didn't get to make it to the convention, AMSN is extending the convention experience all the way through November with the virtual convention extension. Check it out on the website at amsn.org.
On this episode of med-surg Moments,
A very special guest co-host, AMSN President Dr. Kristi Reguin-Hartman.
in November, we'll have a meeting where we get to present on our safe staffing.
The saga of the double life as a during the week stay-at-home mom and weekend.
It was just a way to disconnect from the hustle and bustle of being a mom, wife, all the things, nursing, just kind of to get away.
I'm actually going wedding dress shopping in New York City at the Kleinfelds, which is very exciting. My mom.
I've actually been able to get in some personal reading time. My recent favorite book was
I have less time, but I have more time. Even my husband was like, "What is going on with you?" Our topic today is how to navigate isolation precautions as a med-surg.
And I was asking her how her experience was being a new grad in COVID. You didn't work during COVID? I'm like, you were born in 2003. You're a full.
I don't think people realize all the things that they touch when they have gloves on.
Did your significant other tell you, this is not the time to teach them because
Shoes is the other one where you put your shoes up. Newer nurse, we had a colleague whose dog ended up with C. diff.
Do your facilities provide scrubs for you guys? A study showed that the scrubs were a huge infection risk because people don't.
Something else I do like that certain units do, command hooks on each.
This is Mary Tess.
Sam.
Eric.
Marcella.
LA.
And Sydney. Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud med-surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to navigate isolation precautions as a med-surg nurse. But before we get started, we're very pleased to welcome back to the show a very special guest co-host, AMSN President Dr. Kristi Reguin-Hartman. Kristi, welcome back to med-surg Moments.
Hi, so glad to be here. It's so good to see everyone. I saw a few of you in person in Austin last month, and it was very exciting, and I'm just so glad to be here tonight.
Well, it's always great to have you with us. Why don't you get us started with personal updates and perhaps some AMSN updates?
Well, I will tell you the joy in my personal update today was I did receive the new Taylor Swift vinyl album in the mail. It's orange and glitter, and I've played it through once so far, and it was quite lovely. So that was definitely the personal highlight of the day for those of you Swifties who listen to the podcast. On an AMSN note, we've got a couple things going on that I'm happy to share with everyone. We have a big meeting coming up in November. AMSN is what's called an organizational affiliate of ANA, the American Nurses Association. And so in November, we'll have a meeting where we get to present on our safe staffing standards. And so I'm really excited to get that message out to that audience. There's a lot of big leaders in nursing in that room, and it will be a really good conversation. And we'll get some traction on getting those distributed out and about. The other part of that meeting is the Nursing Organizational Alliance, and that's a group of about 50 presidents of different specialty organizations in nursing, which is even just half of what there are. There's about 100 different nursing specialty organizations. So a bunch of them are in the room, and we talk about nursing and how do we make it better, and we strategize and we network, and it's just a really cool experience. How about you, Marcella? How are things with you?
The saga of the double life as a during the week stay-at-home mom and weekend float nurse. One kid gets sick, and then it's just a domino effect. Then the next one, then the next one, then me, then my husband. Then we start over on the next virus. So we've just been loving life. Excited for fall, honestly. It's a very warm October. And we would like some cool evenings, after a busy day. We would like to walk to the park, see some leaves and some Halloween decorations. So I think we're very excited for the cool weather whenever it decides to show up. Calais, how are you and your family doing?
We're doing pretty good. Thanks for that. Lovely to hear about you and your family always. For me over here, I feel really good and refreshed coming into the fall. My first lady at church, she hosted this awesome women's retreat that was in Myrtle Beach. So I'm just coming off of a beautiful, wonderful, refreshing retreat just to kind of bring sisterhood back into the community and keeping God first and just sharing a refreshing space with a beautiful oceanfront view. We really had some dynamic, powerful speakers, and it was just a way to disconnect from the hustle and bustle of the world, the life, being a mom, wife, all the things, nursing, just kind of to get away. So I feel really good about that.
Calais, I'm so jealous. That sounds so beautiful. I need a weekend like that. All right. How many days was it?
It was a 3-day retreat, so it was very refreshing to come from that. So I really enjoyed that experience. And coming back to professional, I'm still motivated after that convention. I was actually invited by leadership to do a presentation on some of the things that were discussed at convention, some of the things that I learned. So I'm nervous, but excited to share with the leadership team some things that I feel we can bring to our organization. So that's it with me over here. What about you, Sydney? How things are going with you?
Things are going really well. I saw some of the highlights from your retreat on your social media and it looked awesome. It looked like you were having such a fun time and so rejuvenating. You need weekends like that where it's just like girl power and all the things. Personally, we hit a year leading up to my wedding, so that's exciting. I'm actually going wedding dress shopping in New York City at the Kleinfelds, which is very exciting. My mom and I used to watch the show all the time, and she was really excited that we were able to line up a weekend and get an appointment. So I'll be really excited to share those details when I come back. Maybe when I come back, I'll be a Kleinfeld bride. We'll see. But that's going to be really exciting and a really cool experience just to share with my mom. And 2 of my bridesmaids are able to make it as well. So I'm just really looking forward to making some memories.
That's so cool. That's so exciting.
What show? Is that like Say Yes to the Dress?
Yes, Say Yes to the Dress.
Will they record the day you're there?
I hope not. I hope so.
Oh, I hope so.
All of recording I want to be recorded.
Still film? Do they still
do? Yeah, they still make new episodes.
Oh my God, I would love you on an episode.
Yeah, me too. I vote for her to be recorded.
Yes.
I'll email them. No,
Let's start a campaign. Let's start a letter.
Yes.
Well, they put on their website now like when Randy Finoli is going to be there. So you can like try to book appointments with him. And they had posted it a few days after we had made my appointment. And my mom was like, we need to change the appointment. Randy's not going to be there the day that you're going to be there. I'm like, oh my God, Mom, we're not going to get within 100 feet of him anyways. So I was like, it's fine. Let's just leave it. Professionally, or I guess not necessarily work related, but I just finished another course towards my master's. It was a logistics and informatics class. I'm glad that one's done. I'm not necessarily the most techie. I learned a lot about, different systems and workflow analysis and process improvement and stuff like that, which is all important. My next class is nursing theory, so I'm really excited to kind of delve into that topic. Sam, what about you? What's new with you?
Well, I'm super jealous of your Kleinfeld bridal experience. That is like a dream come true for like so many people. So what a great opportunity. And I can't wait to hear all about it when you come back. With me, I've actually been able to get in some like personal reading time, which has been really wonderful for me, both for work and for pleasure. I've been reading Death by Meeting. And then for like more fun reading, my recent favorite book was Atmosphere by Taylor Jenkins Reid. I'm a really big fan of her books. So that was a good one. And it's just been really nice to take some time to read and not just doom scroll all the time. I did have to break up with TikTok. I think it's been over 3 weeks now. And my average screen time has gone down over an hour a day. And I just feel so much more like mental clarity. So this is your sign. If you've been questioning, maybe you need to break up with a social media app. I support you in that 100% because it's been wonderful for me.
When you give up that phone for a few more hours a day, you can feel it physically. Your shoulders, your neck, your arms. You don't even realize the total body strain that social media doom scrolling really, the impact on you is insane.
Yeah, it's been great. There's pieces of it I miss, and I like saved a lot of stuff like recipes and parenting tips or whatever, but I haven't felt the need truly yet to like log back in. I think there's plenty of other things on the internet that I could find elsewhere that's not going to ruin my brain again. So otherwise, we're deep in fall. We've got Theo's Halloween costume. He's going to be a little tractor, little green John Deere tractor. Got him a Carhartt sweatshirt. He's going to look really cute. But Merites, let's kick it over to you and see what's going on.
I'm so proud of you with that social media because it's true. It's that FOMO. But the truth is, we can always Google them anytime we want to. We want a recipe or we want something. But I hear you. I had to let go of LinkedIn. That's what I wanted to do.
I don't even like LinkedIn. I'm on there, but every time I go on, I'm just like, I don't know. It's kind of cringy to me most of the time. Sometimes it's fine, but
I'm very active in LinkedIn because of my role previously as the board of director of the Florida Nurses Association. But as of October 1st, I'm no longer a board of director of the Southeast region in the Florida Nurses Association. So I'll be serving as a nominating committee for the next 2 years. There's a lot of updates that you actually wanted to share in social media. That's the reason why I was so active in LinkedIn's professional network. So perhaps that would slow me down with that social media part, hopefully. But this is an exciting part that I really wanted to share. During our last episode, we were talking about Dr. Melanick, about taking care of ourselves. I need to pat myself here. I started sleeping 7 hours.
wow.
That's amazing.
Oh my God.
It was hard. It was so very hard. I had to make sure that nobody bothers me. The first night, I woke up with a headache and I told my boss, I need to settle down for a minute. I can't do this. Everything is like going around. I don't know. It's weird. But then I started changing my eating habits as well. So I'm no longer eating 4 p.m. in the afternoon for my lunch. I do 11 a.m. to 1 p.m. So during that time period, I don't do the 16-hour intermittent fasting anymore. So I think I'm going to get there.
That's amazing. I'm sure Dr. Melnick would love to know that. We'll have to pass the message on that those tips she gave are sinking in.
Yes, I got to do it because she said you have to really take care of yourselves. But here we are. We're talking about it all the time. And I got to prove to myself that I can do it. I started journaling the effects of it. As we go along with the podcast, I will share with you some of the amazing things that I've been extra doing. I have less time, but I have more time. It's weird. Even my husband was like, what is going on with you?
I love it. I'm excited to hear updates.
Why don't we move on to our topic? Have you ever paused at a doorway wondering, is it contact, droplet, airborne, or all three? Have you ever struggled to balance patient dignity and keep the unit flowing when rooms are on precautions? Today, we are breaking down and opening up with our own stories, experiences, and tips for how to navigate isolation precautions. Who would like to get us started?
I have some thoughts. So it's never easy keeping up with the signs, the orders, what matches the actual lab results. Like, oh, this person's been on C. diff Contact Plus for 2 months. Did anyone ever check to see if it resulted as anything? Oh, yeah, it resulted 2 months ago. No, okay, I'm exaggerating, but up to 5 days ago, we've been counting up for no reason right now. So it is definitely a big topic, especially as a float nurse. I see every unit does it a little bit differently. And I'm interested to hear the ideas of how to stay consistent. We all follow the same hospital policy, and yet we all have different answers to so many things.
Well, I think this is a really interesting conversation to be having in sort of like the post-COVID era, because that really changed, I feel like, how everyone handled precautions, even just from like a mental load standpoint of having to don and doff all the time. And, oh, I'm reusing this mask, but I was taught not to reuse this mask. And now I have my brown paper bag with my name on it. And I actually met someone at the convention. She was a bit of a younger nurse than I am. And I was asking her how her experience was being a new grad in COVID. She's only been a nurse for like 2 years. So she started nursing in a post-COVID era. It's like realizing that people are born in the year 2000 and later. I'm like, you didn't work during COVID? I'm like, you were born in 2003. You're a full-fledged adult. Like, what do you mean?
I was thinking a lot about COVID too.
Yeah, how people's perspectives have changed since that was like the precaution to be following.
I think it became also a household term versus before COVID, no one knew any of these terms. And I was at that time working on a pulmonary step down with the most vulnerable populations to COVID, of course. Even seasonal flu would end up putting these patients in serious situations in the hospital. So, of course, COVID was affecting them. In regards to how at that time, every day they were telling us something different in regards to what the isolation should be. And then the old rule of never reuse a mask, never go into different patients' rooms with the same mask. Just like it became a household term, it also, I think, affected the trust of the population. It affected our trust to the people who make those rules. And then it trickled down to the patient population of, can they trust us? Do we know what we're doing? So I really agree that the conversation starts with COVID.
When I started nursing, the only time I even thought of wearing an N95 was tuberculosis. And then it became a daily wear mask. And so I think that really kind of shook almost how seriously we took precautions. Obviously, you take precautions seriously because you don't want to get sick. You don't want to get your next patient sick. But it was like, oh, there's other stuff out there that we're not even thinking about. Oh my gosh, I have to wear an N95. This is the worst thing that the patients could have. And then it's like, oh no, there's other stuff out there that I need a N95 and a double glove and a gown and booties and my whole scuba suit. You don't fit test right. It's interesting how much it changed the whole precautions field and a nursing perspective on it.
I think it's so interesting you brought up how it's changed over time. There was a nurse I talked to at convention who practiced during the AIDS epidemic, and she talked about figuring out those infection prevention precautions then and how much we learned compared to what we knew and how we had to then reevaluate and regain the trust of the public over time. And then now we've had to do it again with COVID. Then we've got new nurses now who are like, I didn't work through that time. I'm not sure. So it's interesting to see that pattern happen again. I don't know what we do next with it.
Hopefully no new viruses.
Hopefully.
One common thing I hear from a lot of newer nurses and even PCTs in general, the battle that they face with going into the rooms, the hesitancy, the distance. They said they feel disconnected and distant from the isolation patients. So I'm like, wow, like we do sometimes get in that mindset of feeling isolated from the isolation patients. And so for that, one tip I like to give my new nurses, make sure that we're still putting on a face of empathy for those patients, whether it's C. diff, if it's COVID, if it's rule out COVID, things like that. When we place on our donning and doffing our gowns, it's constant repetitive education. Making sure you smile under the mask, making sure you are making that eye contact, even with those foggy goggles. You still make sure that you are giving the eye contact. You are smiling under your mask. You are giving them comfort. It's just always going back to the holistic part of the patient because they're still a patient and they still have feelings. They're just going through an infectious precaution disease. So we brought the education back into our PCT annual ongoing trainings, our nursing trainings, just making sure that they can understand, bringing matching games to it. Consistent education for those newer nurses who haven't been through COVID. So that's something that I'm trying to remember to remind my newer nurses and my newer staff and even my seasoned nurses, because sometimes they get lax as well and they're not being afraid anymore. And they're like, okay, I had COVID patients all through COVID. This is nothing, but you still have to take those precautions and do it right for the standard of care.
Calais, that thing about compassion and connecting with your patient through all that PPE. A few years ago, AMSN in Chicago, they had an art show about COVID and remembering the nurses that we lost and just remembering all of our shared experiences during that time. And my art was a little bit pessimistic about how certain things went, a little critical of how I think the medical community made some mistakes, but we have to be forgiving of ourselves too, because it was an unprecedented time. So I made a piece for this art show and it was exactly about what you're talking about. It's myself. I made it like ridiculous PPE, like an orange peel in my mouth, googly eyeglasses, and just a depiction of what my patient has to see now, because not even their family members can come and comfort them. I don't think any of us meant for COVID to take over the conversation of PPE, but that compassion through the PPE, I think, is really important.
Yeah, I think those patients especially are the ones that you want to be treating with empathy. I mean, you want to treat every patient with empathy, obviously. But I feel like, not that I've been on that patient perspective, but I would just imagine that feeling of almost like guilt or embarrassment from the patient side, because they see the signs on the door. They see us having to begrudgingly put a gown on again just to give them a glass of water, or just to go in and take care of them, and taking those extra steps. I'm sure they feel that embarrassment. Why are they doing this and not that for other patients? Or why can't I leave my room, but I see people walking in the hallway? And just taking that extra time to really make them feel seen and cared for is especially important with those patients that are isolated.
I think too is also just like not really making a big deal out of it and just kind of normalizing like, hey, it's no big deal, or I need to pop back out and just put a new gown back on. Like, just, it's not a big deal. Happy to get you whatever you need. Maybe somebody can grab it for me, whatever, but you still owe them the same amount of time and attention as everybody else. But yeah, I think I would just try not to make it a big to-do and get a little extra sweaty in there, but those gowns are no joke.
I wanted to add that because that is true. Sometimes they feel bad if they see us changing back and forth and they're like, you just need to get my tray. But then I really need to put my PPE on. But also notice the difference between what happened before and post-COVID, since we're talking about that. A lot of patients are more aware of their isolation precautions, and they are now the PPE police officer saying, you didn't put your PPEs. Because I personally noticed that they would tell me, am I still in isolation? Are the nurses supposed to wear their precautions? I said, yes, you are. And so all of a sudden, them understanding what care they should have, they're more involved with their care. I think that's a positive point. But also for us nurses, we need to be more aware that patients are watching. And so we need to do the right thing for them.
And it's a really good opportunity for new grad nurses or just anyone to practice their cluster care, because I remember that was one thing I was precepting during kind of peak COVID on a COVID unit. And I would tell my nurse I was orienting, like, all right, do you have everything you need? We can't be going in and out. We would send her in and I'd kind of like watch from the doorway, and I'd kind of be her runner, so that if she's like, oh, shoot, I need an extra blanket, I need an extra Chuck's pad, she'd be like, hey, Cindy, I need this. And I could go run and grab it instead of us both being in there with full PPE on and then being like, oh, crap, now they asked for a heated blanket and one of us has to go out and back in. So it's a great opportunity for cluster care for sure.
And I know for me, usually what I do is when I have isolation patients, I'll notify my entire team. I say, okay, you guys, I'm getting ready to go in room 102. If I need anything, I will hit the call light now. And that has been a good way to kind of just know that you have someone looking out for you while you're in those rooms, because it is hard to doff the gown, go out the room, the patient is on the call light, and I'm like, I just been in there. So that's a really good point. So clustering care and making sure your team knows where you are and what you're doing, and if you need extra hands hitting the call lights.
I think one of the other lenses that I've been thinking about as we've been having this conversation is people really having an understanding of gloves, which may sound kind of silly and like how simple they are, but really they're intended to help prevent cross-contamination. And it's part of our PPE and whatever. But sometimes I don't think people realize all the things that they touch when they have gloves on, going from pericare or emptying a catheter to then documenting it in the computer, and you don't take your gloves off and wash your hands. That keyboard is now contaminated, whatever else you touched. And so I think it's really easy to get caught up in the busyness of all the tasks and all the things that we have to do to kind of let that stuff slide and finish all your things out, whatever, take your gloves off at the end and leave. But we could really be having a pretty icky impact if we're not being careful about even something as simple as just gloves.
Yeah, standard precautions is still a precaution.
I wanted to say hand washing.
You're not alone. You're not alone, Meritas.
No, it's true, because the gloves really are to protect you, but to protect your patient, like an open wound, a central line. And then that's why we don't use it for the urinal and then type at the computer. But that's still not skipping the hand washing, because we want to protect ourselves in the end also, so we can be there for that patient.
This is kind of a side note, but it's just a funny glove story. That was my favorite thing during COVID, was like seeing people walking around in public wearing gloves. There was a lady at Starbucks wearing gloves, mask, everything. She had her full PPE on to go get her Starbucks, but she's wearing gloves and she touched everything with her gloves on, even like opening her straw and then put her straw in her drink with her gloves on. And I'm like, the germs are on the gloves. That did nothing. That literally did nothing.
Yeah, so I can double down on that too, because my husband and I, we weren't married at the time, but we were actually in Las Vegas when the pandemic really started, like early March of 2020. We're sitting in the Las Vegas airport and a very similar thing. This lady sitting in a slot machine with her gloved hand, hitting the buttons, touching the screen, whatever, then using her phone, putting it up to her face, probably touched her straw, drink, whatever else. And I was just like, wow, the public really has no idea how gloves work. They really have no idea.
Did your significant other tell you, this is not the time to teach them? Because mine says that to me often. They're like, Kristi, this is not the time for a public health lesson. I'm like, are you sure? And he's like, no, let's go. Though,
yeah,
I will sneak some in on occasion.
I didn't say anything, but I was also a little bit terrified because I had a cold. I had a runny nose and stuff. So I was like trying to hide my Kleenex so people didn't think that I had COVID because I needed to make sure I got on the plane to go home.
I don't know what you guys do about shoes. Shoes is the other one where you put your shoes after a long shift. I've always talked to my new grad nurse students about that. When I was a newer nurse, we had a colleague whose dog ended up with C. diff, and it came from her shoes. It was very sad.
Oh, no.
So he ended up all right, but he was sick for a while.
Yeah, I think definitely that's a good thing to have is a pair of work shoes. If your facility has somewhere that you can store them or even you can put them in a bag in your car and then you change them at work. That was always something I kept in my locker was a pair of work shoes. You don't know what you step in pee and blood and vomit all day. Like you have no clue what you're bringing home.
Yep, I agree. Even change of clothes. I always have a change of clothes in the hospital and then change when I get home. And then when I get home, we have a separate box for our shoes. My husband is such a stickler with that. Even visitors, we have slippers for them when they get into the house as well. Because he always really believes that that's something that you bring at home. So you have to protect the kids and the family.
Do your facilities provide scrubs for you guys? The last 2 places that I've worked provided scrubs and like laundered them. At the first facility I worked at, some of the new grad nurses did a study and showed that the scrubs were a huge infection risk because people don't launder them like they should themselves. So the hospital had put in a policy that you had to wear hospital laundered scrubs and get a new pair every shift.
Yeah, at our hospital, only certain units require that. If you're going to mother baby or NICU, super vulnerable patients, I'm not sure of ICU, but yeah, just only certain ones. And I understand why, and that makes sense. Something else I do like that certain units do, command hooks on each patient door, and then they actually have their PPE signs laminated and on a ring. So you're not looking for tape. So many places it's like, okay, we have to literally tape it up every time, or the door has a built-in clip for these signs that break eventually. So just a little like side note, the most simple one I've liked, because you can also wipe them down, is this big metal ring on a laminated board. And then very clearly it says the PPE and the picture of what you need to put on. So I liked it because they had it exactly where I can grab it at the nurse's station because I don't know where anything is. I'm on a new unit every day. The better the system, the more anybody can just jump in and keep moving. So I grabbed it, I put it on the hook, and I'm like, this is funny. It's just someone put command hooks, and it's like life-changing for me on a shift to just not even have to think about that.
Our facility, we have like whole isolation bags. So it's usually stocked with like everything you need. And we have laminated cards for the type of isolation. So you just put that one in the front and then just hang the whole bag on the door with all of the gowns and masks and gloves and all the things that you need. And the certain wipes too, like C. diff versus regular.
If we make the process make sense for the humans using it and we make it as simple as possible, then it's way easier to follow the right policy and process and get it done correctly. So,
Preach.
And I was thinking too, I have a friend, her facility has isolation precaution champions. So they're team members. They all go to the isolation precaution meetings with infection preventionists, and every shift It's one or two of them, and they go through charts and they make sure the nurses understand the precautions. They ask questions. They do all the things to help that primary nurse with those isolated precaution on patients. So that's another good thing.
Before we close, let's go around and have each of you share your biggest takeaway from this conversation.
Mine's just that I want to be a permanent podcast host. I just so enjoy getting to spend time with you all and hanging out. And I appreciate all that you do here. I think this is the last one of the year for me. So I just wanted to say thanks and how much I enjoy hanging with you all. And we have a lot of work to do on infection prevention precautions, but we'll stick with the big one.
We love you here too.
I wanted to say, yeah, I love Kristi coming here all the time because it's a ray of joy. But takeaway, yes, infection prevention. I think we really need to focus on protecting ourselves and having empathy to our patients.
For me, another takeaway is just making sure we all lead by example. We are just not protecting our patients. We're protecting our coworkers, ourselves, and our family. So we just need to follow the precautions to the T, do it correctly, and do it right each time.
I think my biggest takeaway is what Kristi said about workflow. The simpler we make it, the more people are going to adhere to it.
My biggest takeaway is listen to Kelly, because I'm that seasoned nurse. I get to call myself that now. I'm almost hitting 10 years. That wants to be fast and loose sometimes. I'm handing you a cup of water. Oh, I'm not going to be touching a wound. They tested negative anyway. I am that nurse sometimes, but you're right. We need to lead by example, because I won't give up that I know when it's appropriate and when it's not. But I will say that I don't want to be the example for someone who doesn't know when it's appropriate to be fast and loose or not. So I don't want to be teaching a new nurse, oh, my mentor is doing it, I can do it too. Well, you didn't factor in this, and this, but that's not how it works. I can't live by do as I say and not as I do. I really need to lead by example for everyone watching, patients, students, and new nurses.
For me, I think the empathy part is a really big one. It's just so easy to get caught up in the busyness and all the tasks, but we want to make sure that our patients know that we're thinking about them. We want to check in on them and that they're not just going to be left alone on a little isolation island on the floor. So
before we go, we just want to take a moment to once again thank AMSN President Dr. Kristi Reguin-Hartman for joining us.
My joy to be with you guys tonight. So fun, and I loved every minute of it.
To our listeners, thanks for joining us. We'll see you next time. We look forward to connecting with you on the next episode of med-surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to med-surg Moments wherever you listen to podcasts.
To reach us, use hashtag med-surg Moments on your social posts.
or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love med-surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Kelly,
Marcella.
and Sydney. And always remember, med-surg Moments is a moment in our lives and a moment in our med-surg careers that makes a huge difference.